Thanks for having us today. My name is Graham. I'm a director here at Staff Relief, and this is Russ.
Nice to meet you guys. I don't know if we're letting anyone else in the room. Okay, we're okay.
I think the plan is that we're going to do a little presentation for you guys on home care, what it is, and how to access it. And so we'll do the presentation for you, and at the end of the presentation, we can field any questions you might have. And as you have questions, when they come up, just put them in the chat, and we'll be happy to answer them at the end of the presentation. So again, thank you very much for having us, and we'll start the presentation for you.
Thanks, Graham. Great. So like Graham said, if you have questions or any thoughts that come up, feel free to put them in the chat. If you're feeling really excited to ask your question, you may unmute and jump in. The idea here is for us to obviously share a little bit about home care and ourselves, but we want it to be an open conversation and a really nice dialogue. So we'll definitely leave lots of time at the end to go over some of those points that are brought up. But from there, we'll get started here. So Staff Relief is where our company founded about 25 years ago. We're a family-run organization, and we're proudly a Canadian company, and our job is effectively to help recruit and staff and place healthcare workers across the province of Ontario. We're a culturally diverse team. We have a lot of tenured, committed individuals. That's a little bit about how we are, the work that we do. Okay. So a little bit about our values. The 4 pillars that our company focuses on are, as you can see here, compassion, excellence, respect, integrity. I think effectively, to put it in real words, we're real people. Like we said, we come from a family organization. The way that we like to approach the service and the work that we do with our partners, both locally and across the province, is to view it as if, we were finding care for ourselves, for our own families. And it's so important that us here in our office lead by example, across our entire caregiving team in Ontario to ensure that our clients and our families that we get to work with and support really understand that it's a care first type of approach. And, through the presentation, we'll talk a little bit about our philosophy of care. We'll talk a little bit about the types of staff members that we have and, some recruitment practices we like to follow, and that sort of leads us to how we really want to approach working in care. As everyone knows, receiving health care and having someone come into your home is it's a really big deal and can very often be scary, uncertain, invasive, and it's really important that a staff member, a healthcare worker comes in and makes you feel comfortable and safe in your own space. So, a little bit about who we are. We're a pretty diverse, robust company. This is a picture here of some of us at a team building outing we did. We made some clay pots together. It was a lot of fun. This is just something that we like to do from time to time, but our organization is structured to be able to give our clients and our partners wonderful service. We have myself and Rob as co-owners of the company. Graham, as you got to meet here, as the director of our client support and business development program. Oleg, our director of healthcare, who helps us from anything A to Z in terms of clinical oversight and helping with our families. And then we have our scheduling and our HR team, which does not actually even reference, probably about 3 or 4 more names that we have on our team here in the office that help us to be able to provide wonderful support to all of our families. Yeah, so like I mentioned, feel free to jump in if anytime you want, Graham. Our caregivers are the meat and potatoes of what we do. We can talk all we want about great philosophies of care and But as you know, healthcare is a people delivered service, and we think of our caregivers as the most important asset to our team, and we try and choose them really wisely. And I think caregivers these days are also choosing their companies really wisely that they want to work for because of how important it is to feel safe, supported, recognized, and all of the above. So on our end, we invest a lot of time and energy into ensuring that our company provides our staff with a really wonderful and safe workplace. Something we're really happy and proud of. We circled in the bottom left is the group health benefits. Something really unique that we do. I don't know about too many other providers in Ontario that offer their employees fully covered health and dental benefits for them and their families. This is a perk that we think is really necessary. Like I said, our healthcare workers do everything for us, for our families, and we try and make sure that they have a couple things that make sure that they can support and afford the needs that they have in their lives too. And on our end, it helps us ensure, retention and continuity, consistency. So those are a few reasons why we, try our best to give them a wonderful work experience. Like we mentioned about our team, our company operates 24/7 with our scheduling team. These are real people here in our office that are answering the phones, answering emails round the clock. Myself, Graham, Robert, Oleg, the core of the management team. We give our cell phones out probably to too many people, but the idea is for us to be accessible round the clock. Healthcare is dynamic, it's always changing, and it's really personal. And we want to make sure that there is a personalized, individualized support for all of our families so that they feel 100% supported, as things come up and as change. So we service Ontario, like I mentioned, as east as Ottawa, as west as Sarnia and Windsor. Obviously, the GTA is, a really strong resource pool for us, and that is where our office is located here in North York, Toronto. But we have grown our company to support a lot of different rural areas as well, and trying to work with a lot of local partners across the province to find out where their needs are and what families and communities are talking about in their local areas, and how healthcare can be of a bigger support. So that's a lot of our initiatives, to consistently try and expand ourselves towards areas that might be in need of additional support and lacking in certain resources.
Okay. So now that you know us, thank you, Russ.
No worries.
Let's talk about home care in Ontario and how to access it. One of my primary roles with the company is picking up the phone when someone wants to talk about home care. So I'm particularly passionate about helping people navigate through the system, if even not with us at Staff Relief Healthcare. So the first things first would be access your subsidized support. So there's programs run through the government that if you qualify, you will get subsidized free in-home care. Always get what you can get free first, and then take the next step. So that can sometimes be a bit more challenging than you might think. So a lot of us may have heard the term CCAC. So that used to be what the government was called, that was in charge of home care. They later changed their name to the LHIN. They've since then changed their name to Home and Community Care Support Services. And more recently, they've just changed their name to Ontario Health at Home. So Ontario Health at Home is what you would want to be looking for while you want to access that subsidized support. So you utilize the subsidized supports first, and oftentimes it can be very minimal. So you could maybe qualify, or your loved one could qualify for 2 hours per week. So I mean, maybe 1 hour on a Tuesday and 1 hour on a Thursday. Even if it seems very minimal to you, and you might think, it's not even going to help, we would suggest taking it, because if you take it, It ensures that private companies such as ours don't have to charge HST, which is quite all right with us. And it also means that you or your loved one is kind of a part of that system, which then can branch out into long-term care, other services, wound care. It's just good to be part of the Ontario Health at Home. Oftentimes, you're going to get referred if you had a trip to the hospital, they'll refer someone to do an assessment. Or if your physician were to order it from the doctor's office. Of course, you can call them directly to see if you can arrange an in-home care assessment and or referred by your primary physician. So I'll open this link here to give you a sense in your area, if it is going to open. Um, so the home health at home in the Champlain area, here's the link and here's your information. And there's several different offices. So it's kind of chunked up into Ottawa, Bell's Corner, Cornwall, Pembroke, Renfrew, Winchester. And that's how you'd access it yourselves to see if you would, in turn, or loved one would qualify for the subsidized support. So if you are successful in having your physician or the hospital or yourself reaching out to get an in-home assessment, some tricks that we've learned both professionally and personally with our own loved ones would be ensure that you have a loved one present in addition to the client. Because oftentimes, you've got someone from the government sitting with a clipboard, taking questions down, asking things like, do you shower for yourself? And often someone with some level of memory impairment will say, absolutely, I do. Like my own grandmother, only we knew that she wasn't doing it. So we needed to be present to kind of say, oh, no, that's not entirely truthful. Otherwise, she wouldn't have she wouldn't have been eligible for the help. So Health at Home supports personal care. They don't support daily chores or tasks. So a tip for you, if you're trying to arrange this subsidized support, is really make it about your personal health and don't make it about how it's difficult to sweep the floor, make the bed, do the laundry, because technically that's not going to get you that in-home support you need. Don't deflect the assessment as something that supports a primary caregiver. So don't make it all about the patient and not about the primary caregiver that needs a rest, because that's not going to make you or your loved ones eligible for this free care as well. And always reiterate to your loved one, none of us like to admit that we're growing older. Probably why Russell and I still have hair gel under our sink. Maybe we might need it one day. But really reiterate to your loved one, take the help, it's free, right? If you can make it so that it's free, you've paid your taxes for this, you might as well access it. Normally, people will receive that care a little bit better knowing that they're not paying for it. What do you get? So if you're eligible, you're going to receive anywhere from 2 hours to 12 hours of personal care, government funded per week. Services times may fluctuate. They can be from 45 minutes to 2 hours, kind of a day. It all depends on how medically, on how the client is doing, both physically, cognitively, with their own personal care. And also cluster care can be arranged, and it's a bit more regimented, meaning that if you or your loved one seeking care lives in an apartment building that has a lot of seniors in it, or lives in a retirement home, then you'd be eligible. And that care tends to be a little bit more, you can count on it a little bit more because the caregiver's not just going 40 minutes to your home somewhere, they're going 40 minutes to one room, 40 to the next, and it's a viable workday for that caregiver. And so the care tends to be a little bit more reliable if you live in an area where you're not isolated all on your own.
To Graham's point, we'll hear sometimes from families who are even just looking for more information. That, I mean, they're very pleased to always receive free care and support. It's awesome, but sometimes it can be inconsistent, or sometimes they're getting new people every week or every shift, perhaps. And sometimes people aren't even able to come because if they're shorter visits or a little bit of a less accessible area, staff members may not be able to get there. So if there is a way where there is a cluster care, arrangement, it does provide a little bit more stability and likely consistency as well.
So that's great that you're eligible for 2 to 12 hours of care in a week, but there's a lot of hours of care in a week. So what if you need more care? If you need more care, then that's when you turn to a company like ours and purchase private home care. And when I field calls from people, oftentimes it can be a bit of a sticker shock, right? And people would say, "Oh, I had no idea," but that's maybe why you're attending this. And now you'll know that private home care in the Ottawa region is going to range anywhere from $33 an hour to around $42 per hour. Normally, it's not taxed because if you're getting that help from the government, then you don't have to be taxed. And most companies out there, private companies, there is a 3 to 4 hour shift minimum length, and that's for good reason. Oftentimes it can seem like a lot of care, but you don't have to choose this care daily. You could have it on Mondays and Wednesdays. You could have it just on weekends, so you can get things done or your loved ones can get things done. Normally it's very flexible, and unlike the government, you get to kind of choose your time of the day, frequency of visits. That's going to, because you're a customer at this point. You're no longer getting it subsidized for free from the government. So, what questions should I ask when choosing maybe a private care service? You can Google private home care, and many different companies are going to come up. We've been in the space for over 20 years, so we know the questions we field, and we know the traps that some of our our clients have fallen under with other organizations. But ask if the caregivers are employees, right? Ask if they are certified personal support workers. So a lot of people out there call themselves a caregiver, but a certified personal support workers are basically who we work with. We're a healthcare company. We're not a companionship company. We do focus on individuals that have that healthcare background. I myself am a personal support worker, started in 2001, but it is important to have someone with that schooling background and those core skill sets. Ask about the private company's insurance coverage. You're having guests into your home. You're going to want to make sure that the company that you're working with has got not only adequate insurance to keep you and your house covered, but their own employees covered through WSIB, through any other workplace insurance that we need to carry. And ask if they can work with private insurance. So I find more and more that I discuss with people, a lot of us out there have access to insurance that we may have purchased years ago that might cover some long-term care expenses or some in-home personal attendant care is what it's referred to with insurance companies. Always check, see. We work with so many insurance companies and providers. Most of the time, I would say 100% of the time right now, we're able to just bill that insurance provider directly, as opposed to you having to pay, client having to pay, and then get paid back by insurance. Another good question to ask out there is, does the company subcontract their caregivers, or are the PSWs, personal support workers, employees of the company? So you found during the pandemic that there was companies like ours that were plugging along, doing our thing. But as the pandemic came, a lot more started to spring up because they saw it as a means to get into the market and help people, and people were stuck at home. But oftentimes they're subcontracting their caregivers. These poor caregivers, they work away, and then at the end of the year, they don't realize that they're on the hook for thousands of dollars of back taxes because they weren't paying taxes. They weren't an employee. So of course, our team members are employees, and we make sure to insure them and take good care of them. Ask if you can pivot, make changes without penalty. So we have a one-page agreement that basically gives us consent to make a file for you. But after that, if you want to cancel, you can cancel. If you want to modify, you can modify. Oftentimes, a lot of these companies that did spring up during the pandemic, now that their work is starting to get lesser and lesser, they are charging penalties for canceling. And in healthcare, like Russ said earlier, it's so robust and changing all the time that we don't feel it's fair to have any penalties associated with canceling or changing. Ask what duties the caregivers can perform. So the caregivers that come from the government, the subsidized care, they will not be able to push a broom. They will not be able to do laundry as a rule. Sometimes they do, but that's maybe because you've got one that's breaking the rules. Us, we're honest up front, um, and say what duties. We're private, so we basically kind of do what we're told within reason. However, there are some things we can't do. So we can't transport people in our own clients in our own personal vehicles for many a good reason, but we can't. So these are some of the things that you might want to ask beforehand. And because if you're thinking a personal support worker is going to help take your loved one to the grocery store and shop, oftentimes it's not the case. Ask about the tenure of the company and if there is any nursing oversight. So in essence, all of us personal support workers are working under Oleg's license. So he wants to make sure as an RN that we are doing what we're allowed to do and not overstepping and doing some things that we're not supposed to do. Oleg is also in charge of our training, so ask about the trainings. In addition to having a personal support worker certificate, which is about a 9-month program with about 400 practical hours, ask if they have gentle persuasion approaches, which is an additional training, first aid and CPR. Are they vaccinated against COVID or flu vaccines? We also require team members to have a TB test done every year and a vulnerable sector search police check done every 6 months. So these are things that you might want to ask if you're entertaining a service provider that's not us. You don't have to ask us now because we just told you.
This might be really the most important slide of the whole presentation, honestly.
Yeah.
It's, like kind of little gold tips that you can keep in your back pocket for conversations that might come up maybe now, maybe down the road. Sort of like we explained at the beginning, our philosophy in our company is looking at care as if we were approaching it for our own family members. And if I was researching a company or even talking to folks from the Ontario Health Network and trying to navigate care for a family member of mine, these are the questions that I would ask. These are the things that Graham would ask. We want to know that the individuals that are coming into our home or our family members' homes are properly certified, vetted, covered, and prepared and ready to do the job that we're asking for. And it's a really important thing to advocate for and to ensure that you're knowledgeable on in advance. And if there's ever a concern or a hesitation that you don't feel good about and the answers that you're getting, that's okay. We'll share more information with everyone after, and of course our own information. We're always here to talk through these types of points, but as you'll navigate these things on your own at some point in time, we really do want to emphasize how vital it is to go through this list, make sure that you're thorough and that your provider that you're talking with is thorough as well and able to substantiate any of the concerns or questions that you might have. Thanks for that, Graham.
Yeah. So benefits of home care is, you remain. What I talk to people about is that yes, I can do the care for Russ. I can do it. But when someone else does it, now I can be Russ's coworker and friend again. right? I don't have to be his primary caregiver. And I think that's what you find, from if you have a loved one suffering from memory impairment and you are the primary caregiver, to give someone else even just one or a couple hours a week those duties, so then you can once again be the spouse or a loved one, daughter, son, friend. It's important.
Mhm.
It allows freedom for you to enjoy time away for your loved ones. So we know what it's like having a loved one with memory impairment. Sure, they're functioning okay, let's say in the house. You got to go get some groceries, go to the bank, but that whole time you're just rushing, wondering, worrying, right? And oftentimes it can lead to the primary caregiver becoming ill before the person with memory impairment. Continuity, it can help develop a routine and trust with the caregiver. So, oftentimes as a PSW myself, it's hard to walk in and give someone a shower day one, right? They may need to meet that individual once or twice before that trust level is there, or the PSW has learned how to navigate with that individual and get them in to a shower. It's really hard to happen overnight. Um, it's beneficial because someone with memory impairment, if they're familiar with that atmosphere and environment, it's not new to them. Um, it can improve the primary caregiver's mental health, physical health, and keep both people at a home happy and healthy. It just provides peace of mind. I find more so for the adult children of loved ones with memory impairment, that they're the sandwich generation, right? They've got kids they're dealing with, their parents are dealing with. To know that a caregiver from staff relief is coming in on Wednesdays to take care of some of those duties is really nice. Um, it can reduce risk of acute illnesses, such as we see them every day. Urinary tract infections, falls, dehydration are probably the main things, right? So a caregiver that comes in every day that leaves Mrs. Smith with a glass of water bedside or near her lazy boy is a lot less likely to end up in hospital because all she drinks is dehydrating tea day after day, right? Re-engage with family and loved ones. So I just talked to a client today. Graham, your caregiver comes at 4. Could she come at 11 a.m. and take my mom to my daughter's wedding and then come home with her? Absolutely, right? So it just makes it so that your loved one that may need care is able to still join in some of these holidays, fun events, things like that. Those are some of the benefits. So limitations, and we're almost we're cruising, guys. So we're getting there. Limitations, and so you're aware, right? We discussed PSWs are not going to be able to drive your clients, right? Not only can't do it, but it's against most city and town and municipalities bylaws, right? So that's why you need to have an Uber license or a taxi license to drive someone around. Not all of us could just start a company and drive people around, right? Um, I would suggest caregivers should not be shopping or have access to PIN numbers, Visa cards. It's not something that you typically want to share. In my 23 years, I've not seen a personal support worker abuse someone's banking information, but I have seen clients with memory impairment forget, that they have hidden money, have taken money out of the bank, and so it's best just to not have. Don't allow that with anyone. Um, PSWs in home can assist with medication. So we can say, Russell, have you taken your pills? Here's your blister pack, pop it out. We're not going to be administering. So when it comes to the point where pills need to be crushed, put in applesauce and kind of in the hanger, that's not something typically your average PSW is able to do. Um, if private pay can get costly if 24/7 is needed, but there's often ways to work with someone like myself to get creative and say, listen, why don't we let ourselves out at 11 p.m. at night, lock the door, your loved one's got a lifeline they can push if they need someone. We'll come back at 7 a.m. and then we've just saved you 8 hours a day of care, which can be costly. Um, Meal preparation limitations. We prepare a lot of meals in-house. And I get asked a question all the time, can your caregivers cook? Yes, they can cook. Russ and I are cooks, so we cook differently than our loved ones might cook, right? So we can never say how great their cooking abilities are. Um, Logistics, refusal of care. I mean, there's if everyone has the right to refuse care, right? So you will find with memory impairment specifically, people will refuse that care, and there's no forcing care upon someone. So oftentimes it's best to just have good care plans, right? We name drop family members. We walk in like we've known someone for years, right? These are tricks that happen, but they can take some time. Um, and caregivers need balance too, so we get it every day. I really liked Ruth, who served my mom. I'd like her 7 days a week. Ruth can't work 7 days a week because she needs to have balance too, right? A good caregiver needs some time off in order to be a great caregiver the next day, right? So oftentimes, if you do need 7 days a week coverage, you're going to have to utilize at least 2 to 3 people because everyone needs a holiday, and a lot of us in healthcare can fall ill. Um, Yeah, this brings us to basically our philosophy care where we started with Russ. We believe strongly that care should be individualized and understand and support each person's specific needs. So not one of our care plans looks the same. And when we're developing care plans specifically with families, private families at home, it's important to be honest, right? It's important to be honest if your loved one has any hang-ups about anything, or if they definitely don't want a male or they don't want a female. We're very used to working with seniors that have responsive behaviors and triggers. So it's good to be honest right out of the gate.
I think like a good way to maybe put this in better context, the philosophy of care, as we go back to the limitations, is to talk about how we can take limitations, flip them around, and find solutions. Because a lot of times, some of these issues are actually really important needs. Like, for example, someone that requires a staff member, a PSW, to drive them is not because they want to go for joyrides and, cruise the town, but maybe they actually need to get to medical appointments that are weekly, something like that. So, sure, we don't allow our staff members to drive, but maybe with some collaboration and some help, we can come up with a strategy to get on public transportation or come up with a taxi subsidy or something like that, where the staff member can get in that car or on that bus with the client. Administering medication is a tough one because PSWs, by the designation of their work, their certification, they're not a nurse. They're not to administer medication, but there are some things that they can help with pertaining to medication. And if you go back to that idea of the philosophy of care, is that care is individualized and very often needs are not always heard. From our end, our approach as a company, which isn't exactly what this presentation is intended for, it's more to help you guys really gain knowledge on what this looks like. But this is something for you to really think about when you have to come up with a plan of care, is seeing and hearing how the support is individualized. And people's needs are really important. And cooking, as one example, meal preparation is maybe one of the most important things when it comes to memory and feeling safe and secure and at home, and eating familiar food and smelling familiar smells and things like that matter. And if there's a way that a staff member can learn and adopt some of that strategy, it goes such a long way. And yeah, as you can tell, Graham is super passionate about that. And that's why we really put a lot of emphasis on finding not just somebody to come to a home, but the right person, right?
Yeah. And we're honest, meaning that, if we get a call and someone says, I need care and I need it right now, then we will be honest and say, we can get you care right now, but if you want continuity of care and the same caregiver, then give us 24 hours to work on this and
Right.
free up some schedules, and we'll get that for you, right? Um, So that kind of concludes our presentation on how to access care in your region and some things to look out for.
Hi, can you hear me?
Yes, we got
Oh,
you.
great. Thank you for the presentation. Great ideas for like with especially when you guys said, well, you can't drive clients, but you might be able to accompany them on public transit. Great ideas. My question specifically was regarding one of the very first slides when you were talking about having another loved one present just so that the information is complete and honest. And there was a point there about deflecting something, and I didn't really catch what you guys were talking about.
I mean, to boil it down, is that I could never secure I could never secure my grandmother subsidized care. And it was because one of us wasn't holding her hand while she was getting that assessment. Because really, the person doing the assessment doesn't know her. My grandmother presented very well, and could answer questions very well, but every single answer to the question was a lie. And I think when we talk about deflection, it was more, you know, I don't, my grandmother specifically, once we did finally get her that subsidized care she needed, she would just say, I don't need it, I don't need it. And what we find is to say, most of the generation we serve is very cognizant about budget and money. So if you say it's free, they're way more apt to take it. Or if you say, we know you can take care of yourself, Mom, but it's Russ and I that are struggling with, we worry and we're sick with worry about you. If you would just take this help, it will help us feel better, and really deflect it onto yourself and make it so that your loved one doesn't think that they're sick, that they need care, right? And it tends to soften it just enough to get that success.
Gotcha. I understand the point now. I missed it, and then it was we were on to the next slide. So yes, that does make
Okay.
sense.
Sorry about that.
Sorry.
No, that's okay. It's I'm dealing with this with my parents and my father, and you're absolutely right. They don't want to they don't really understand the level of help and support that they need, but they don't want to bother me, and they don't want to bother, oh no, let's not go to the hospital because they're so busy, and they're
Yeah.
worried about costs, and they're worried about, yeah, they're it's a different generation, and they're proud, but I just missed the deflection point, so I got it
Yeah.
now. Thank you very
But
much.
in those situations, Sheila, it's so normal, right? And it's just none of us, none of us really want to admit that we need help. But I've worked with families to say, hey, first of all, we get very busy in January because that's when everyone goes home, sees their loved ones, and realizes just how much help they need. But you could say, hey, my brother and I have bought this for you for the month, right? We've already paid for it and we can't cancel it, right? These are little tricks that you can kind of sometimes use memory impairment to your favor, because we know that once we get a caregiver in there 4 different times, they will really see the value and everything we can get done. And then they're comfortable, and then you can say, yeah, my brother and I aren't going to pay for this anymore, right? But whatever works. I mean, you have to start somewhere, and these are little things that can get you over that hump, right?
Yep, true
With
enough.
us,
Another great idea. Thank you.
yeah.
I do have one other question. I missed the first couple of minutes of the presentation. What is the name of your specific company?
Staff Relief Healthcare.
Staff Relief Healthcare. Thank you very much.
Yep.
You're welcome.
So we're family owned. So Russell and Robert couldn't be with us today, and we're over 25 years old. I'm not one of the brothers, but I'm just blessed enough to have one of their haircuts.
Honorary.
And where are you based out of?
All of Ontario. So we've got about 400 active personal support workers and nurses in the field from Windsor to Ottawa. So only in Ontario right now. Some of our caregivers live in Quebec, but their work in Ontario with us in Ottawa. So we're quite spread out. And yeah, but we've got a robust team in the Ottawa area as well.
Very nice. We're in the Ottawa Valley. You look familiar. I thought maybe we had crossed paths regarding this issue before, but maybe not.
No, we could have. I'm normally in Ottawa at least once a month. We've got great partners there, so I go and meet partners. So actually my son goes to school there. My parents live there, so I get there. I get there a lot actually.
Nice. Thanks.
Well, we really appreciate the opportunity to speak with everyone. Um, and don't hesitate to pick up the phone and call us. Like I said when we began, if we can't help you, then chances are, because of our history, we can find someone that can. And really, we're just passionate about making sure everyone gets the care that they need, period, right? Whether it's with us or through the government or whomever, maybe a companion company, who knows? But feel free to use us as a resource as you have questions. It's what we love to do.
Yeah, I really appreciate this. I'm mainly the main. My parents live on their own, but if they need something, I'm the number one child that comes to help them out. Although we have 6 kids in the area that are really great with them, but as my dad's age and health and diseases progress, my mom is taking on more of the little chores around the house that he used to do. And as his physical care increases, more of it lands on her shoulders. So it really is, I'm kind of looking, I was interested in this information today, as a relief for myself, but also for my mom, who she's 86 and she's taking on more of the burden now, and I can see it taking its toll on her. So this is really, really great information. I really appreciate it.
Well, that's great. Thanks for saying that. We appreciate that.
I mean, it comes up a lot. That's pretty common, pretty typical. And we find, I think it's human nature. We tend to usually react. We're not overly proactive, especially when it comes to our own healthcare. Very often, we speak to families who are in crisis, coming out of the hospital, dealing with a critical incident. Something dramatic has changed and they require intervention and support. And we're great at crisis intervention. We that's what our job is. That's why we operate 24/7. That's why we make ourselves, super accessible, because we know that there's crisis every day. Part of this presentation, part of I think our work the last couple of years has really been to help educate our communities, our local friends and families, and just continue to put outreach there for all of you to not pick up the phones and call staff relief for service, but to have conversations with your loved ones amongst yourselves, to think about care plans and how do you want to support yourselves? Do you want to age in place? Do you want your parents to age in place? Do you want to move to an assisted living? Do you want to have care bedside? Just little things that are difficult and uncomfortable to uncover and discuss. But there's a lot of success stories. We could get into the really sad stories, of all those risks and caution signs that we put up in the presentation about what to look for, what not to look for. The success stories are, shine above those. There's so many awesome cases where we've been able, or maybe not us, but we know people have been able to support themselves. And so we appreciate everyone's time. Graham said it well. I know we're wrapping up here. If you ever need something from us, not just service, but a conversation, questions, we make ourselves accessible and open all the time. We want to help you guys navigate things that you come up against down the road. And please don't hesitate or be shy to reach out to either one of us. And we'd be more than happy to steer you in the right direction and give you a little bit of guidance. Okay?
Yeah, thank you so much.
Welcome. Thank you, everyone.
Thank you.
Thanks. Have a great day.
Okay, you too. Enjoy your afternoons.